welcome to On Call After Hours, where we answer some of the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, and we want to answer as many as we can for you. So let's just get rolling. First question from Sioux Falls: how does CLL turn to large B-cell lymphoma consistent with Richter transformation? Also, does Richter transformation qualify for stem cell transplant? So I didn't understand. How does CLL turn to large B-cell? That's the first question.
So CLL is an indolent kind of B-cell malignancy. So
Yes.
slow-going.
Slow-going, chronic lymphocytic leukemia.
Exactly. Like any other malignancy, have the opportunity or the chance to go into a higher grade disease. And that's what Richter disease means, or Richter syndrome. So basically turning into a large B-cell lymphoma, and characterized by fast-growing lymph nodes,
So an
causing more
acute
symptoms.
Oh, like a lymphoma.
It is a lymphoma. It's diffuse large B-cell lymphoma. So changing from the indolent form to the higher grade form, the aggressive form. This is lymph nodes, night sweats, bigger spleen, counts coming down, could be actually increasing in the large cells in the peripheral blood. The question of stem cell transplant is a very good question, because induction of remission would be number one, so giving chemotherapy or target therapy to bring the person into remission, then consider transplant, and I would actually advocate for more allogeneic transplant at this point, meaning donor from sibling or unrelated.
Okay, all right, and that brings the question of lymphoma. How close is that to leukemia, Kelly?
Well, most things in hematology are quite closely related. Leukemia and lymphoma, they kind of cross over in the differentiation. So how we classify them, the lowest and the slowest growing leukemias and lymphomas can look very similar. And at the highest end, the fastest growing actually can look the same as well. And so there's kind of crossovers at multiple points.
It's a circle.
It gets very complicated.
Yeah. Rapid City, this caller wants to know about organ transplants in general. Please discuss who can donate and how do you set this up? Must be on life support to donate, for example? What about organ donation, liver transplants? You don't have to be on life support to donate part of your liver, do you?
No, so we are both pure hematologists, so we don't do any of the solid organ transplant work, but correct, people that want to donate, I would recommend it. LifeSource is one of the many different organizations that filling out your driver's license can all be good. And really many different things can be harvested, so corneas, skin, pieces of bone, cartilage, heart valves. You could get all kinds of different tissues that can be donated.
So, I mean, put your name on the list that says whatever age you are, that if I'm in a motor vehicle accident, I don't have a chance of recovery, let part of my body be donated. But you can still be alive and donate a kidney, for example, or part of your liver, or
Correct.
There's other things that you can donate.
Let's make sure that bone marrow is the largest organ in the body. So we should actually think of bone marrow, and you can donate that when you're healthy and actually save life that way.
All right. So if you want to learn more about this, you go to lifesource.com.
Yeah, you could just Google it.
Google LifeSource.
Yeah, organ donation. Even at the DMV, Department of Motor Vehicles, there's a little tick box on your driver's license. You can, take the pathway of donation.
Okay. My brother died from leukemia 4 years ago. He had several procedures of bone marrow being drawn from his hip area. Was this being done to check on leukemia progression, and is there some other way to do this? So he had leukemia, he had bone marrow biopsies and aspirates. I think that's
It's very standard.
very standard.
Yeah.
Not all the time do people need to be under anesthesia, but a lot of times people are having anesthesia. You probably always use anesthesia.
We
when
do,
you
actually, yeah.
because they get a lot of it. So I do bone marrow biopsies and aspirates without putting them to sleep, but it's generally a person that doesn't do a lot. They don't need a lot of these. It's a diagnostic test.
Yeah.
Here's a call. Husband has eye melanoma. He did plaque therapy, did not do a biopsy, didn't want to spread. What can we expect? We treated as a primary tumor. Eye is healed as tumors do. He has gone back to work, still has some vision loss, 3-month checkup in November. What should we watch for? What happens if this cancer has came from another location? So melanoma, malignant melanoma in the eye? Do you know enough to answer that?
Not really. Not me, at least.
Not comfortably.
Okay, but I would say that you just have to lean on your eye specialist. on
Very
that
much
one.
so. Ophthalmologist,
Oncologist.
an oncologist, so a solid tumor person would be.
Would know the answer
They
to
would.
those.
And
yeah.
as any other disease, actually, melanomas has been lots of improvement in the treatment and advances. So that's a
And it sounds like this person's still alive, doing well, and no recurrence at this point, so we cross our fingers. Here is from Hot Springs, Billy Rush. He recently had a stroke and is walking stairs daily and working on his garden for exercise. Family of 6 siblings all sit down as a family to enjoy this wonderful program. Thanks for calling. I guess it was a comment only. Thank you, and hello to Billy. Sioux City, Iowa. What is the difference between Hodgkin's lymphoma and non-Hodgkin's? Which is worse? So you want to summarize the difference?
Yeah, historically we have separated out Hodgkin's from non-Hodgkin's lymphoma, and a lot of this was done on basic microscopy work, so looking down a microscope. Nowadays we're realizing that there are probably some overlap. We know that some of the same cells, B cells, can be involved in both non-Hodgkin's as well as Hodgkin's. Historically, the treatment has been very different, and so that really was the primary thing to pull these two diseases apart. Where there's 50 or 60 different types of non-Hodgkin's lymphomas, at a minimum, that's just the B cells. The treatments can be very similar, so we lump that category. But for Hodgkin's, when we look down, we can see the difference. The treatments are very different, so it's separated out those two diseases. And so it's really a historical differentiation between them.
Okay, but it's defined. They are different,
There's no question they are different.
and sometimes they're treated differently.
Often they are. Most of the time they're treated totally differently.
Okay.
Yeah.
All right. And our last question: fibromyalgia. What's good to eat? What not? Any other pointers? So fibromyalgia. Does fibromyalgia, now this is not fibrous tissue of the bone marrow.
Yeah.
This is fibromyalgia, which is a kind of an aching all over, kind of a rheumatology question. Would you guys have any suggestion in fibromyalgia?
I'll leave this to Kelly.
Kelly, it's your
It's
question.
my question. Well, you know, fibromyalgia is a very common disorder, and I don't know if there's any specific foods to eat. You know, you may be able to comment as well. I mean, I'm sure you've got a lot of patients in your practice with fibromyalgia.
Well, and my answer is that, you know, lifestyle is the most important thing. You know, exercise regularly like you can, eat a balanced diet, try to keep your calorie count down, and but exercise as much as you can. That's the key. Well, thank you for joining us on our website. We appreciate all of your questions and the opportunity to answer them. Be sure to join us next week on South Dakota Public Broadcasting at our regular time. I won't be there, but 2 old friends of the show, Tom Luzier, Aberdeen Asthma and Allergy, will guest host with Jim McGran. He'll be asking Jim questions about dermatology with a bent towards allergy. And watch for our columns in your local newspaper. Listen to our On Call Conversations radio show on a station near you. And until next time, stay healthy out there, people.